Okay, let me get to the right slide, and I'm just going to pick up there. Okay, so we talked about all the uses for antihistamines. I know that you guys couldn't hear the last slide. All it was just some medications that interact with antihistamines. And so some of the biggies are MAOIs, which we're going to learn about. CNS depressants, which CNS depressants are going to slow the respiratory rate, and they're going to make your patient tired. And when we give antihistamines with these drugs, it's going to be an additive effect. You know, they're going to be extra tired and extra suppressed. And then the beta blockers actually interfere with a lot of things, y'all. I know y'all are starting to see that, that we can have some increased cardiovascular effects when we give those medications with antihistamines. So I made a blank here, and I was going to give y'all a break anyway. But let's just go through this real quick. So decongestants is another little, when we're talking about our umbrella of upper respiratory drugs, we talked about antihistamines. Decongestants, what they do is they produce localized vasoconstriction of the small blood vessels in the nose. So they basically squeeze and dry up, okay? And so every drug that we take is going to have a different source of action. The antihistamines are blocking that histamine before we even get those hay fever type symptoms, whereas the decongestants are drying it up after we've had that response. It's drying it up, and it's constricting those blood vessels, and it's resulting in less stuffiness and less nasal drainage and all of that stuff. So we're using it for the same type thing. We're using it for the common cold, for hay fever. Examples of those decongestants are, like I told you earlier, Sudafed, phenylphenephrine, okay? So the thing that you need to remember about decongestant, and you can think of it and you can just say that I'm weird if you want to, they could affect the heart. They could affect your heart. They can cause tachycardia, nervousness, restlessness, insomnia. So your cardiac patients usually should not take decongestants because we're affecting those blood vessels, right? We're not trying to constrict vessels that are already a little too constricted. Am I right? All right. And then we're going to use them cautiously for patients with thyroid disease, diabetes, cardiovascular disease, prostatic hypertrophy, which I told y'all, just for lack of better terms, is high blood pressure near the prostate, coronary artery disease. So they're not good for people. They're not good for the heart. Okay. And they interact as well with MAOIs and beta blockers. All right, and that's that drug class. We've got one more, and then we're going to take our break and we're going to do our review. Expectorants increase the production of respiratory secretions. So expectorants, you want your patient to expectorate. We're wanting them to cough. We're wanting all that stuff to come out. So instead of suppressing, like antitussives are going to relieve and suppress. Expectorants, we want them to cough stuff up. They increase the production of respiratory secretions, which in turn appears to decrease the viscosity of the mucus, which is the thickness. So they basically thin stuff out so that you can cough it up. It helps to raise the secretions from the respiratory passages and bring up the respiratory secretions. Okay. They can cause lightheadedness, dizziness, and drowsiness. And that's it. And we're gonna do this on our own. So from slide 27 all the way on, that's just our application. That's our application of all the factual knowledge that I just gave you, from the key points in the back to the first part of this slide, that's basically all the info. The rest of this is this is your ad pie. This is your what are you assessing? All of the stuff that we're doing. What is your implementation? What is your evaluation? So we're going to take a break until 10 o'clock. And I'm going to run out of time lecturing today, but that's okay. We'll make up for it tomorrow. We're going to take a break until 10 o'clock. And then when we come back, we're going to split into our groups and we're going to all turn off our mics and we're going to look at each other and we're going to talk it out. And we're going to do some practice questions. Okay. So take 15 minutes, regroup, go get your life together and come back in at 10 o'clock. Okay.